Hello everyone, welcome to my channel Anupma Biology Classes, and this is the last video of the Human Physiology series. Today our topic is disease and disorders in humans, and this is part 9th of the Human Physiology series. So let's come on the topic, in which we will discuss about the disease and disorder, that what is disease and disorders. So, disease is a pathophysiological response to internal or external factors, and disorders is a disruption to regular bodily structure and function. Now, here we will discuss disease and disorders in each and every part of human physiology except sensory and endocrine system, because we discussed earlier in the previous videos of the sensory system and endocrine system. So, here the first is digestive system, and in the series of disorders of digestive system, first one is bacterial or viral infection, which results in the inflammation of the intestinal tract, and the number of invertebrates like tapeworm, roundworm, threadworm, hookworm, etc. are responsible for this type of infection. So in this infection series, first one is jaundice, in which it affects liver, skin and eyes, which turn yellow due to deposition of bile pigments. In the picture you can see the color of eye, which is yellow, and here it is caused by a buildup of bilirubin, a waste material in blood. For the recovery, we should drink more water, and fruits like papaya, mango, sugarcane, etc. we can use in our diet. The next is indigestion. It is due to improper digestion of food, and the patients have a feeling of fullness. So, the reason of indigestion are inadequate secretion of enzymes and anxiety, overeating, spicy food, and even food poisoning. Next is constipation. It is the result of irregular bowel movement, and the feces are retained within the rectum. Vomiting. It is the phenomena of ejection of stomach content through the mouth. Before vomiting, you will feel nausea, and it is a reflex action in which is controlled by a specific center in medulla oblongata of the hindbrain, and this may leads to dehydration. Next is diarrhea. It reduces the absorption of food and frequently leads to dehydration. In this case, abnormal frequency of bowel movement and increased liquidity of the fecal discharge occur. Now, the undernutrition and malnutrition. So, what is undernutrition and what is malnutrition? Undernutrition is taking a diet deficient in calories, while malnutrition is taking a diet lacking one or more essential nutrients, that is, essential fatty acids, essential amino acids, minerals, and vitamins. Undernutrition may also result from inability to digest, assimilate, or utilize the necessary nutrients. And the most common type of malnutrition is protein deficiency. So now here the nutritional disorders, and if in your diet nutrition amount is not adequate, then it causes deficiency disease, and in some cases excess of nutrients also cause disease. So your diet should be balanced. In the nutritional disorders, first one is kwashiorkor. It is a protein deficiency disease. It commonly affects infants and children between 1 to 3 years of age. In this picture, you can see kwashiorkor patient, and the symptoms are hair changes, edema, fat present, underweight, wasted muscles, poor brain development, loss of appetite, anemia, slender legs, stunted growth, bulging eyes, etc. Here a word, that is edema. Edema means swelling by build-up fluid. It often affects the legs and ankles but can affect any parts of the body. And for the cure of this disease, adequate amount of protein must be present in the diet. From where you can get protein? So, protein are found in cereals, pulses, meat, fish, milk, cheese, leafy vegetables, groundnut, peas and beans. Next is night blindness, which is caused by the deficiency of vitamin A. It is inability of the person to see in dim light. It is due to deficiency of rhodopsin in the rod cells of retina. Now, marasmus. It is a form of prolonged protein energy malnutrition, PEM in short you can say. It affects infants under 1 year of age. In the picture you can see a patient, and here it is caused by simultaneously deficiency of proteins and food calorie value. It affects the infants if mother milk is replaced too early with foods having low protein content and calorie value. The symptoms of this disease are normal hair, old man face, no edema, very little fat, wasted muscles, very underweight. And this leads to diarrhea because digestion and absorption of food is stopped due to atrophy of digestive glands and intestinal mucosa. And the cure of the disease is adequate protein and proper calorie values should be given to the infants. After this, xerophthalmia, that is dry eyes, which is caused by the deficiency of vitamin A. It is an eye ailment due to the lack of secretion of lacrimal or tear glands. In the picture you can see this is the picture of xerophthalmia. Because of this, bacterial growth, thickening, keratinization and ulceration of cornea and even blindness also. Now, beriberi. It is caused by vitamin B1 deficiency. In this, loss of appetite, decrease in weight, retarded growth, degeneration of nerves, muscle atrophy, malfunction of Krebs cycle, heart failure, and edema of hands and legs. Then, killosis, which is caused by vitamin B2 deficiency. In this, inflammations and cracking at the corners of mouth occur. Next, pellagra, which is caused by the deficiency of vitamin niacin. In this, skin eruption, swollen lips, digestive disturbance, and nervous disorder occur. Then, pernicious anemia, which is caused by vitamin B12 deficiency. In this, malformed means large, immature, nucleated RBC with hemoglobin occur, and it is very fatal. Then megaloblastic anemia, which is caused by deficiency of vitamin B12 and folic acid. In this, presence of large immature nucleated RBCs in the blood. Next, rickets and osteomalacia. It is caused by vitamin D deficiency. Rickets in case of child and osteomalacia in case of adult. If affects children, here bones become thin, soft and weak due to poor deposition of calcium and phosphorus, and the long bones become deformed. While in case of osteomalacia, which affects the adult, characterized by weak bones, liable to easy fracture. Now, bleeding disease, which is caused by deficiency of vitamin K and characterized by delayed and faulty blood clotting, causing excessive bleeding. Now, caries, it is caused by deficiency of fluorine. In the picture, you can see the structure in which cavities in teeth occur. After this, goiter, which is caused by deficiency of iodine, which involves enlargement of thyroid gland. Next is scurvy, which is caused by vitamin C deficiency, and in the picture you can see it's a scurvy patient, and this causes bleeding in mucous membrane, gums and joints and under the skin. Symptoms are falling of teeth, fragile bones and delayed healing of wounds occur. Next is sprue. It is caused by deficiency of folacin or folic acid. In this, ulceration of mouth, inflammation of bowel, inability to absorb especially fats, diarrhea, weakness and anemia occur. Then microcytic anemia, which is caused by iron deficiency. In this, RBC size and number reduced and the hemoglobin content also reduced because You know that hemoglobin is present in RBC, so because the color of the RBC is due to hemoglobin. So if RBC will reduce, hemoglobin will definitely be reduced. Now the disorders of the overnutrition. Here there are many disorders. First one is hypercholesterolemia, which is caused by excess saturated fats nutrients, and the symptoms are high blood pressure, coronary thrombosis, heart attacks, etc. Second is obesity, which is caused by excess food calories in sugar, honey, ghee, etc. And the symptoms are fat deposition, overweight, high blood pressure, diabetes, heart ailments, etc. Next is hypervitaminosis A, which is caused by excess vitamin A in nutrients, and the symptoms are lack of appetite, sparsity of hair, itching rashes, painful swelling over long bones, etc. Next disorder is hypervitaminosis D, which is caused by excess vitamin D nutrients, and the symptoms are deposition of calcium in soft tissues. Next disorder is fluorosis, which is caused by excess fluorine nutrients, and the symptoms are mottled teeth. So this is the end of digestive system disorder. Now the respiratory system, in which the disorders of the respiratory system. The first one is hypoxia, which is a condition of oxygen shortage in the tissues. The hypoxia is of two types. First one is artificial hypoxia, in which it results from the shortage of oxygen in the air as at high altitudes. In this, breathlessness, headache, dizziness, nausea, vomiting, mental fatigue, and bluish sting on the skin occur. Second is anemic hypoxia. It results from the reduced oxygen carrying capacity of the blood due to anemia or carbon monoxide poisoning. Now there is phyxia. In this, the oxygen content of the blood falls while the carbon dioxide content rises and paralyzes the respiratory center. In this case, breathing stops and death occurs. Now, the bad cold. Disease causing microbes present in the air attack respiratory tract, producing inflammation of the mucous membrane in the various regions and increased secretion. So, these secretions are of four types. First one is rhinitis, which is in the nasal chamber. Second is sinusitis in the sinus, pharyngitis in the pharynx, and laryngitis in the larynx. Now, bronchitis. It is the inflammation of bronchi. So, in this figure, you can see inflammation in the bronchi in the second picture. So, first one is the normal condition of the bronchi, and second is bronchitis condition. You can see the bronchitis here in the picture. Here, infectious microbes present in the air results in the hypertrophy. It means overgrowth, and hyperplasia means increase in number of cells of the seromucous glands and goblet cells lining the bronchi. So by this the infection, the bronchial lining swells and produces excess mucus, and the symptoms is regular coughing with thick greenish yellow sputum. So in the bronchitis figure you can see the greenish sputum, and the prevention and cure of this disease is avoiding exposure to smoke, chemicals and pollutants. Now pneumonia. Pneumonia is an acute infection due to inflammation of the alveoli of the lungs. Alveoli, due to accumulation of mucus in them, do not get enough air to support life. So in the picture you can see A, B and C part. A is the normal structure, and here the complete view of the normal alveoli in the B, and after that alveoli with pneumonia in C portion. It is mainly due to infection by Streptococcus pneumoniae bacteria. In such patients, the uptake of oxygen is adversely affected due to inflamed alveoli which filled with excess mucus and dead WBCs. It can be cured by the use of antibiotics. Now, the occupational respiratory disorders, and these are silicosis and asbestosis are the common occupational lungs disease. So, if a person working in industries involving grinding or stone breaking, etc., suffer from this disease. In prevention of this disease, use of protective gears and clothings by the workers at the workplace. Workers should be pre-informed about the risk of exposure to such dust and regular health checkup of the workers. Now, the carbon monoxide poisoning. A lamp burning or the coal burning in a closed room produce carbon monoxide by incomplete combustion due to shortage of oxygen. A person sleeping in such a room gets carbon monoxide poisoning, and the deficiency of oxygen causes headache, dizziness, nausea, paralysis, and even death also. Now, emphysema. This respiratory disorder is due to inflation or abnormal distension of the bronchiole or alveolar sac resulting in the loss of their elasticity. In the picture you can see in emphysema person, normal alveoli is structure and the alveoli with emphysema structure. Here, cigarette smoking and chorionic bronchitis are the causes of this disease and one can be prevented by avoiding exposure to cigarette smoke and pollutants. Now, the bronchial asthma. It is an allergic attack of breathlessness associated with bronchial obstruction or spasm, which is characterized by expiratory wheeze. In the picture, you can see this is the bronchial asthma and this is the normal structure of the bronchioles. It is caused by due to hypersensitivity of the bronchioles to the foreign substances which is present in the air that passes through them. So, the goblet cells lining the respiratory passage start secreting excess mucus, which may clog the bronchi and bronchioles. The best preventive measures is avoiding exposure to the allergens or the foreign substances. So, this is the end of the respiratory disease. Now, the circulatory system and the cardiovascular disease, in which the first one is hypertensive heart disease. First one is arteriosclerosis. It is the hardening of the arteries and arterioles due to thickening of the fibrous tissues and the consequent loss of elasticity. So it is caused by the hypertension or high blood pressure. In this disease, the calcium salts precipitate with the cholesterol of the formed or forming plaque. So because of this calcification ultimately makes the wall of arteries stiff and rigid. Such a clot in the coronary artery may lead to a heart attack or even death. Next is atheroma. It is narrowing of the arteries and arterioles due to deposition of fats, including cholesterol or their lining, that is the tunica interna, and smooth muscles. So, such a plaque formed the arterial wall, it leads to high blood pressure. When such plaques are formed in the coronary arteries, the blood supplies to the heart may reduce or may completely stop due to complete blockage which results heart attack. So this is the fatty deposits in case of atheroma. Now the hypertension. Nervous tension and emotional stress causes contraction of the arteries. Persistently having the resting arterial blood pressure more than 120 by 80 mmHg is called hypertension, and it is a silent killer. It may rupture arteries in the eyes causing blindness or in the brain causing temporary or permanent paralysis that we called a stroke. Here, the high blood pressure in the arteries of kidneys causing chronic nephritis. Now, the coronary heart disease. Angina pectoris is the first coronary heart disease. It means pain in the chest. It results from arteriosclerosis of the arteries that supplies the heart muscles itself, that is the coronary arteries. So because of lack of required expansion, these arteries are unable to carry extra blood to the heart muscles at the time of stress when the heart is beating more vigorously. Now the heart attack. Formation of clot in a narrowed coronary artery stops blood supply to the part of the heart muscles beyond the clot. The muscle cells of this part die due to lack of oxygen and glucose. This condition is called heart attack. It is characterized by several pain in the heart, breathlessness, restlessness, nausea and vomiting. So in this picture you can see the lipid deposition and artery size decreases. So because of this it causes tension on the blood and create high blood pressure, which may lead to death also. Now rheumatic heart disease. This results from repeated attacks of rheumatic fever in childhood. This fever is caused by the infection of throat with the bacterium. That bacterium is Streptococcus. Bacterial infection may reach the heart and the bacterial toxins affect the auriculoventricular valve. So, the damage to the heart valve detectable by a modified heart sound called murmur. Such a heart is said to be rheumatic. And a serious damage to valves greatly increase the chances of congestive heart failure. So, in the prevention of the heart disease, avoid tension, avoid saturated fats, avoid becoming overweight, do light exercise daily, avoid smoking and drinking and use of drugs, avoid overwork and consult a doctor if any pain in the chest occurs. Now the heart block. This is interruption of the conduction of the electrical impulses from the right auricle to the ventricle through the Purkinje system of the heart. So heart block is of two types, in which the first is AV block, in which impulses from SA node do not reach the AV node, and the second is bundle branch block, where impulses fail to reach the ventricle. Now, stroke. Stroke is the brain damage causing a sudden loss of some function such as loss of speech, memory or hearing capacity, paralysis of limbs, loss of consciousness, or sudden death. A stroke occurs when blood supply to some part of the brain decreases greatly or altogether stops. Now, the atrial fibrillation. It is a heart rhythm disturbance causing a fast and irregular heartbeat. It occurs when a smaller upper chamber of the heart contracts in a very rapid and unconscious manner. Now, tachycardia. It means a fast heart rate. It may occur while exercising or due to serious life-threatening heart problems. If heart rate continues to beat above 100 beats per minute, this condition is known as tachycardia. Now, the treatment of coronary artery disease, in which it is of two types. First one is angioplasty and stents. This is the non-surgical treatments, in which the first is angioplasty or balloon angioplasty. In this picture, you can see balloon angioplasty, which involves the introduction of a catheter with a deflated balloon on its tip into the body, usually through leg. The catheter is thread through the blood vessels into the blocked heart arteries. So, the balloon is inflated to open the blood vessels to improve the blood flow in it. Now, this is the picture of stent in the coronary arteries. It involves use of a wire mesh tube that props open a blood vessels that has just been cleared by angioplasty. In this, the stainless steel tube is first collapsed and then placed on the balloon angioplasty. Catheters, when this tube reaches the blocked arteries, the balloon is then inflated, expanding the stent into a position that will hold the artery open. It is better than angioplasty. Now the second, that is bypass surgery, and this is the surgical treatment. So in the picture you can see this is the bypass surgery structure. It is an operation which performed by the doctors. So this is the end of the circulatory system. Now the excretory system. And here the kidney disorders, in which the first one is pyelonephritis. It is an inflammation of the renal pelvis, calyces and interstitial tissues. It is due to local bacterial infection. And the symptoms of the disease are pain in the back and frequent painful urination. Second is glomerulonephritis, which is the inflammation of the glomeruli, which is caused by the injury to the kidneys, bacterial toxins, drug reactions, etc. Now cystitis. It is the inflammation of the urinary bladder, which is caused by bacterial infection, and the symptoms of the disease is the frequent and painful urination with burning sensation, which is not occur in case of pyelonephritis. Now the kidney stone, that is renal calculus, it is formed by the precipitation of uric acid or oxalate. It blocks the kidney tubules. So it causes severe pain in the back, is spreading down to the thighs, and the surgery is required to remove the stone. Next, uremia. It is the presence of an excessive amount of urea in the blood. Urea poisons the cell at high concentration. And the last is kidney failure, that is renal failure. It is partial or total inability of the kidney to carry an excretory and salt water regulatory functions. So it leads to uremia, salt water imbalance and stoppage of erythropoietin secretion. And here the dialysis should be started as soon as possible after the diagnosis is established. So this is the end of the excretory system. And here you can see in the picture, that is the causes of the acute renal failure, which is of three types: pre-renal, intrarenal and post-renal. Now the musculoskeletal system, and here the disorders of the skeleton and joints, in which the first one is sprain, which refers to the injury to a joint capsules, typically involving a stretching or tearing of tendons or ligaments, and it is a minor disorder but it may become chronic also. Now arthritis or aching joints, it refers to inflammation of the joints and it has many forms, in which the first one is osteoarthritis. Here the secretion of lubricating synovial fluid between the bones at the joint stops. In this figure you can see the smooth cartilage covering the ends of the bone at the joint wear out due to years of use and is replaced by uneven bony spurs. So the joint become inflamed and the movement become painful. This stiffness is called ankylosis. Next is rheumatoid arthritis. It is a chronic painful inflammation of the synovial membranes of many joints simultaneously. This is the structure. It involves erosion of joints. It usually starts at 20 to 40 years of age. It affects the women more than men. You can get relief by exercise under medical advice. Next is gout. It is an inherited disorder of the purine metabolism occurring especially in men. In this, the body forms excess amount of uric acid and the crystals of sodium urate are deposited in the synovial joints, giving rise to severe arthritis. A person should avoid meat if he has gout. Now, the osteoporosis. Osteoporosis is the reduction in the bone tissues mass causing weakness of skeletal strength. It results from excessive reabsorption of calcium and phosphorus from the bone. It results from excessive reabsorption of calcium. In the picture you can see this is the osteoporosis structure. Here a healthy bone and the osteoporosis. So here it occurs in the postmenopausal woman and the elderly man. In this, pain in the bone, back and the vertebral occur. For prevention, patients start to take supplementary calcium and do exercise regularly. Now, dislocation. It is the displacement of bones from their normal position at a joint. For instance, slipping out of the ball of one bone from the socket of another bone into which it is fitted. So, it is accompanied by pulling or even tearing of the ligaments, which tends to become chronic. And then the slip disc. It is the displacement of vertebrae and the intervertebral fibrocartilage disc from their normal position. It may result from mechanical injury or defects of ligaments holding the vertebrae together. Now, the fracture. Fracture is the break of bone, and it occurs rarely in children, which is of many types, in which the first one, that is a simple fracture where bones break completely into two parts which remains close together. Second is green stick fracture, which is merely a crack. Next is comminuted fracture, in which the bone breaks into more than two pieces. Then the compound fracture. Here the bones break completely, but a fragment passes out through the skin. Next is evulsive fracture. A small piece of break off fully from the bone but remains attached to the ligament. In the picture you can see all the type of fractures, that is normal, transverse, oblique, spiral, comminuted, avulsion, impacted, fissure and green stick fractures. Now, bursitis. It is inflammation of the bursa present in the joints, and it is leading to fatigue, weakening and ultimately paralysis of the skeletal muscle. Now the tetany. It is a muscular disorder in which rapid spasm in the muscle occur due to lesser calcium ion in the body fluid. Next, the myasthenia gravis. It is an autoimmune disorder that affects neuromuscular junction. And the last is muscular dystrophy. It involves progressive degeneration of skeletal muscles due to genetic defect. Now the last is, that is the nervous system, and here the disorders of the nervous system, in which the first one, that is poliomyelitis. It is an acute viral infection that destroys the cell bodies of motor neurons in the anterior horn of the spinal cord, which you can see in the picture. Now, second is meningitis. It is an inflammation of the meninges. It is generally caused by the infectious organism like bacteria and virus. Next, sciatica. It refers to pain along the sciatic nerves, that is slipped intervertebral disc in the main cause of sciatica. Other causes include osteoarthritis and pregnancy. Then last is neuritis. It is the disturbance of the PNS. In such instances, either sensory fibers or the motor fibers or both may be damaged. So, this is the end of disease and disorders in human, and this is the last video of the human physiology series. Now, the upcoming video is cell, their structure and the function. So, from the next video, we will start cell biology. So, if you understand this video, please like and share it and subscribe to my channel Anupma Biology Classes. If you have any questions, any queries, any suggestions, you can write it down on the comment section below. Thank you for the watching.